Greetings. My name is Louise Dente, and I welcome you to yet another edition of Cultural Caravan. On this edition is a special as we're joined by three distinguished ladies. To my far left is Dr. Shawneladee Cole. She is a psychotherapist, training psychoanalyst, and a professor at Hunter College. And then next to her is Dr. Tyrene Wright. She's an author, she's a CUNY professor, and she is a scholar of African history. And last but certainly not least is Soraya Nickens. She is an executive board member of Cultural Caravan TV. Welcome. Today we're going to talk about particularly medical racism, a topic that has been really of concern as relates to the treatment of people of African ancestry. And before we do, I just wanted to ask Dr. Wright to talk to us a bit about some of the history of medical racism.
Well, in the United States, we have, of course, James Marion Sims, who about 100 years ago was involved in establishing the field of gynecology as a result of experimenting on formerly enslaved African women at that time. And it actually was responsible, those experiments were responsible for the strides made in the field of gynecology. And so there's a long history of using the Black body for experiments to advance the sciences. And so that's one of the legacies of racism in this society in particular, right? The use of the Black body for experimental purposes. But then you also had, of course, the Tuskegee syphilis experiment, which began in 1932. And it was a government experiment which was conducted in the rural county called Macon County in Alabama. And it actually had about 600 people involved, 600 rural farmers who were illiterate, uninformed, and did not give informed consent to engage in the study. And their bodies were used to study syphilis, untreated syphilis, in the Black body in particular. And so that's another example. And that experiment lasted from 1932 all the way up till 1972. And during somewhere around 1940, there was confirmation that syphilis was in fact curable with penicillin. However, the participants in the study that they did not consent to would not receive the cure. So that's just a little bit of the legacy of what some people call medical apartheid in the United States over the last 2 centuries.
As we think about the psychological toll is taken on our community, as well as the social, emotional. Dr. Cole, can you please enlighten on some of the other impact of this medical racism?
So in our field, there are several aspects of it. There's mental health, there's medical social work as well. And in many cases, social work followed the model of the medical field. So often there was misdiagnosis, there was poor treatment that was given, poor lack of services that was given. It was based upon pretty much how a person looked, who was considered deserving, and in our community, in the Black community, they weren't considered deserving. So we often got less services, and the backup after you're getting medical treatment, the social services that are supposed to follow it afterwards, were also lacking as well.
Soraya, what is your perception of what's going on with particularly with what's happened with the vaccine, before the vaccine, COVID, treatment of us, and then of course what people's perceptions are?
This is why a lot of people have reservations, especially in the African American community, about taking the vaccine. I mean, now it does seem like more people are interested in taking it, but there's still much more reservation with African Americans than with other groups. And this is because as Sister Wright just explained to us, there has been a history of abusive behavior and malfeasance on the part of the government when it comes to African Americans in medicine, or neglect, or just treatment that people, this is the reason for the distrust, and rightfully so. I would say now, when it comes to the virus, a lot of us aren't told things that we also should do. We have to really, your immune system needs to be intact at times like this. And too many times with African Americans, we've been all of the fast food commercials, all of the bad food in the society, everything that is not healthy seems to be focused on us and directed towards us. And we have to be in charge of our own health. You know, we have to cut down on the GMO foods. We have to police our health and make sure that we're taking, like for me, myself, I take a lot of supplements because I feel that your immune system has to be boosted. Eat a lot of fresh fruits and vegetables. Stay away from a lot of artificial things that are really going to tear you down. You know, we have a lot to take control of when it comes to our health. If we know that the society is not looking after us, and it hasn't, I mean, it has a history of doing that, then it becomes our responsibility to take care of and look after our health ourselves, and we can do that. Maybe that's one of the reasons why people talk about, I mean, I don't want to get ahead of myself, as far as Africa not having the same reaction. Now, I know a lady who just came back from there, a Ghanaian, and I asked her about this, and she stated to me that they take herbs. You know, a lot of times being out in the sunlight, they find that it's much better for them as far as this virus is concerned than being inside under air conditioning. But they have their own little herbs and remedies that they take, and it seems to be working for them. So I'm not saying that that's everything, but we have to take more control of our own health and be in charge of looking and seeing what's best for us and our bodies during this time.
Dr. Cole, tell me about your perception of the immunization. What is your perception? Do you think people should take the vaccine?
Within our community, there is a history of mistrust in many systems, but especially in the medical and psychological field. But I think the other thing to also consider is that COVID has really hit our community very hard, and the living conditions that we have, because many of us are, we're living in a dense environment. We're multi-generational, so grandma, you know, grandson, mom, even great grandma could all be in the same home. And although this has been a strength of for our community, unfortunately with COVID, that is part of the issue because we're so close. So these are certain things that affect our community in a certain way. So the vaccine does offer a way of protecting ourselves that many other communities are taking advantage of. And I definitely think it's something that we should consider.
Going back to what you were saying, Dr. Wright, about what the medical establishment, okay, and how we have become the victims, and looking at it from a historical perspective. What do you think about this pandemic in terms of the and the impact it's having on our people historically, from the perspective of looking at it over a landscape of time?
There are a number of factors that historically protected us, like living in extended family formation protects us from a hostile society, but also makes us vulnerable in light of a pandemic. You know, I teach students who are in the City University of New York, and it is the largest public institution in the nation, but most of our students, and I should say most of our students are students, people of color who live in multi-generational homes. And that means that what impacts them as a young person also impacts everyone in their household. So I think there are some historical factors in terms of how our communities are structured that make us more vulnerable to the virus. However, I do not subscribe to the idea that Black people biologically, for some reason, are more susceptible or less durable or have weaker immune systems or have a predispositions, because we've seen people from various ethnicities who had the same pre-existing issues, and one survived and the other does not. So meaning diabetes and things of that nature. We've seen people in, of other ethnicities outside of the Black community get hit by the virus and still survive. However, I think one of the issues here is right back to the institutional contact. When we are in the hospital, when Black people, when African Americans are in the hospital, you could be in a bed right next to a white or ethnically Caucasian counterpart and get very different treatment. Okay, this has been proven time and time again. We've had people come out and say during this pandemic that they believe they have not gotten the kind of treatment that they feel they deserve or is comparable to the treatment that their Caucasian or white counterparts are receiving. We know in terms of child and maternal health, we know that Black women in particular, in a recent study, were shown to, in New York City, to die 12 times at the rate of white women in childbirth. We know recently there was a study done in Florida, but it proved to be a study that was applicable nationwide that said Black babies who had white doctors were 3 times more likely to die in early infancy, okay? And having a Black doctor increased the child's life chances by 3 times. So we know that we're not getting the same treatment. We know that although we live in a so-called developed nation, we do not have access to the same resources in the field of medicine.
In terms of life expectancy and where we're at and perceptions of stress, and stress is definitely, as they say, stress is a killer. Stress is what creates the high blood pressure, it creates the tension, the mental health. What about on children? When we think about the stressors and the fact and how this is the impact on the children, Dr. Cole, talk to us about that.
If you told us maybe 30 years from now, the kids that are kids at that time would have the opportunity, they didn't have to go to school. They could just kind of stay home and hang out and not have to go to school every day. That would seem like a dream. And with our kids today, when this first happened, all right, great, we're out of school. We don't have to do it. You talk to most of the kids now, they want to go back to school. They really, really do. The rates of anxiety have gone up. The rates of depression has gone up because they're staying in the house. They're not able to get out to see their friends. This affects how they're able to interact with other people. I mean, these are just basic things that, you practice, you learn how to engage and socialize with other people in school. And many of our kids are missing out on that. I mean, we heard a lot about the seniors, how they're missing their proms and they're missing their graduations. But think about the kindergartners who just have not gone to school yet. They haven't had that experience. And as much as people want to go back to school, I think it's going to be a huge adjustment when they finally do. Not that they can't overcome that, but I think we do have to be aware that even when we do get back to school, there's still going to be a challenge because people haven't learned how to interact with each other. They've sort of forgotten some of those skills. We've been wearing masks. We don't know what people look like. We don't know those little social cues when somebody's walking by, how you nod and how you smile, because everything's behind a mask now.
Okay, so right now we're going to change gears and let's think about corrective, preventive things. I mean, Soraya, you talked about the fact that Africans are not suffering the level of infections that, I know I was talking to a sister from Guinea, and she was saying, look, there's less than 10 people affected, and you're talking about 2 million people, the fact that Africa is by no means are impacted the way we are. And, whereas people, we talk about medical things, all of us know that we all grew up looking at these terrible pictures of African children emaciated with bugs flying on their faces. And in Africa was always the face of disease. Remember, Ebola, everything. Now it's the opposite, where, you saw these horrible situations in European countries like Italy and all those that were impacted by this disease. And, just the devastation. Africa, because of a number of things, including the use of herbs, as well as being able to benefit from vitamin D, which is sunlight, something that many of us here in the North, because of the fact that we are indoors, we are deficient in vitamin D. And as a result, that's also some of the reasons why people may be susceptible to some of these diseases. So you're thinking about the power of, our culture, but getting back to preventive things, how we can prevent things naturally. So, Soraya, you talked about herbs. What other lifestyle things that you think that people could do to really, not just COVID, but in general?
The society, unfortunately, has taught us a toxic lifestyle, and we have to understand that. And we have to adjust what we do. I mean, all of the commercials, everything coming at you tells you to consume things that are not good for your body. A lot of the fast foods, as I said before, are GMO or have things that basically tear down your body. And people are taught to go after something because it looks like it tastes good, and instead of the nutritional value. What happens with Africa is that because people, they're more connected to the soil, a lot of people do not have money to just waste on fast food and other things. They cook food that's, comes from the soil, that's better quality. They don't really have a lot of GMO stuff over there. And so that also helps to keep your body fortified at times like this. And also we have to think of the fact that Africa has had more than its share of so-called pandemics. There was Ebola, there was AIDS, so Africa's used to having a situation where they have to tell people to do certain things, and believe it or not, they may be more prepared and have more lessons for the West and how to deal with the pandemic than any other place, which is probably another reason why they're doing so much better. But it's like in the West, there's an arrogance. They like to look down on Africa. They like to say negative things, and they don't feel that they have anything to learn. They feel they know it all. And so African solutions that may be helpful, like I heard in Senegal, they developed a $1 COVID test. And instead of the more expensive ones that they were having, because they had to do it because they don't have all this money to be spending and wasting on something that's going to cost the government so much, but it worked. They also developed a ventilator that only cost $60 instead of the ones that cost thousands of dollars here. Why? And they printed it on a 3D printer. And this is working. These solutions are working, and they're much less expensive. And like I said, these people, because they've had experience with things like this before, they're better able to manage this now. Europe, because they've had all these so-called modern conveniences, they've never and a pandemic hasn't hit them since 1918. So they really don't know what to do. It's been 100 years. Over 100 years since the last one. So they don't really know what to do. That's why they're doing so poorly. So this is part of the reason, like I said, I feel Africa has a lot to teach, but unfortunately the students are lacking because of preconceived notions.
Tyrene, when we think about, as Soraya was saying, just really rethinking how, particularly one thing about the African spirit, we're resilient people. We've survived the worst Holocaust of enslavement. The fact that we're still here, the fact that all 3 or 4 of us are still here is a testament to the strength of our ancestors and their perseverance through it all. When you think about strategies for maintaining and sustaining ourselves, even going back south, what were some of the strategies that our elders and ancestors did to maintain themselves, and what could we learn from that in terms of preserving our health and wellness?
One of the things that's interesting about the African presence in the Americas is that the women very often were the herbalists, the doctors, the scientists, naturally, in our communities. And so I think one of the things that we can implement now is that we can try to do a little bit better in terms of consuming real food. Meaning that if it wasn't made by nature, then you probably don't want to eat it. And this is something that I practice and implement in my own life. If I like something, I try to get the purest version of it as I can, right? So nature's version of everything. So, and that's one of the advantages many of our ancestors have had over present generations, in the sense that they may have had hard lives, challenging lives, laborious lives, but they ate real food. So many of us have grandparents who lived to 80 and 90 years old without any major illnesses because they actually were eating real food, and their constitution was different than many of us living right now. And then the other thing is that I think for us and our survival rates, we do know in terms of COVID that high doses of vitamin D actually increase one's ability to fight off the virus and survive the virus if you do have an encounter. And so where do you get vitamin D from? You get vitamin D from the sun. You can take oral supplements of vitamin D, but the best form of vitamin D you can get is from the sun, direct sunlight. When all else fails, go out and get some sun. It will change your attitude, it will change your energy. And yes, African people have always had a relationship with the sun. We are best equipped to be in the sun, hence the ability to manifest melanin. And so I think that's one of the other things that have put us to some degree in the Americas to a disadvantage, and our brothers and sisters on the continent to an advantage. The ability to be in a locale where you have access to the most powerful thing you can, sun, direct sun. And so that is one of the factors as well on the African continent, the likelihood of coming in contact with direct sunlight. Because COVID is there, it is not having the impact that it's had in the Western world. On the continent, we are surviving it, but I work for an international Black tech company where I am actually able to hear the reports from young people who are keeping track of the numbers in every African country that we know of. And so there are incidents of the virus there. However, the survival rate is a lot higher and the mortality rate is a lot lower.
And we think about that. Let's talk from the mental, emotional. What are some of the mental, emotional things we could do to heal ourselves and keep balance?
So I think it's important to realize we know the negatives that happened during COVID, and in terms of the things that we lost. But if you talk to a lot of people, one of the things that they gained is that they learned a new skill, maybe gained a new hobby, because we had to shelter in. I mean, that was our country's response to this situation. And people were able to learn a lot about themselves. And we couldn't use the traditional ways that we sort of self-heal. We couldn't necessarily go do yoga or go to church. So we had to find alternate ways around that. So I would encourage people to still continue that. Like, we used to have to run around a lot before COVID. We were doing all these things outside, and we had to learn how to do things inside. And I would encourage people to continue that. What did you learn about yourself? Don't lose that as our society tries to move back to what was considered normal.
Thank you. And I know that there was something that you said you do is the hula hoop. Okay. Do you have a group of people who do the hula hoop, or how do you?
Virtually, yeah. Hula hooping, it's an underground community, believe it or not, especially of adults, because it's not something that you think about adults doing. But it's something, especially during COVID, you can totally learn how to do on your own. We do have a Black Hula Hoopers group. Of course, it's on Facebook. But when we see each other, when other Black hula hoopers see each other, we become lifelong friends, because we know this is something probably a lot of people around you aren't doing. But so that's definitely something I encourage.
As we were talking, I just remember being out so much as a child, constantly running, jumping, playing, interacting, playing with my hula hoop, double dutch, all the things we did to keep active and healthy. And we were certainly more healthier as children than the children are today, because of the fact that, people are playing the video games, they're sitting down even before COVID. And certainly, unfortunately, some of our children are adopting some of these health issues that really wouldn't confront them until they were 20, 30 years older. So we definitely have to help our children to adapt, even post-COVID, behaviors that will make them active and keep them healthy. But let me just say, I really thank all of you for sharing your pearls today, my sisters, and certainly look forward to having you back as we continue to explore topics of interest to our community. So thank you so much for joining us. Well, I hope you've enjoyed this broadcast, and we continue to encourage you to tune in, to write, and to tell a friend. And please visit us on our website at www.ccptv.org. But until next time, Louise Dente saying thank you.